Greetings, everyone, and welcome to the Change of Shift podcast. I am your host, Sean, with my lovely co-host, Emily.
Hello, hello.
How was your day?
My day was fabulous. I got to go hang out a little bit at Art Prize in downtown Grand Rapids. So that was it's always amazing to see what people bring to our small town that's turning into a very large town. So
I see we're sporting something here.
Yes.
Yeah.
For those of you who can't see the video, my best friend's a metalsmith, and I helped her with a live demonstration today for a private event that was part of Art Prize. So that was good fun.
Nice.
So how's work?
Yeah, it was okay. It could have been a lot worse. So I won't complain. Every day I start to complain, I always try and use my same advice that I give everybody else, is that, today I wasn't the patient, so it couldn't have been that bad. So
usually my comeback for that is nobody's dead, nobody's shooting at me.
Yeah.
So, well, tends to put stuff into perspective, but in our job, it's not always the case.
I'm sorry, but we do literally live in life and death. So
yeah, we do.
That's what we work with. So, all right, we digress like we always do.
Indeed.
So tonight's episode is titled "Dear New Nurse, Never Fake It" with the hashtag #AskTheNP. We will get to the meat and potatoes of the reasoning behind that in a little bit. Just like every show, we're going to start off with a little bit of a recap. This is episode 5.
Can you believe it?
Episode 5
already.
And let me just hover over my name for a second here. We have been on Blab for 31 days.
Wow.
Let that sink in for a second. So insane. So 5 episodes into this new podcast, and we're just rolling right along. So episode 4 was the title, "What It Takes to Be a Nurse," with the hashtag Nurses Unite. We are not going to get into the deep details of that, but we spent one more time talking about the ladies from The View. And we decided to review it for a brief moment, but then to utilize and talk about why that faux pas was so important to our profession and, quite honestly, so important to our show.
If it weren't for that faux pas, I don't think we'd be 5 shows into it already.
I think we would, but I don't think we would have as much zeal.
That's a great way to put it.
Using big words there.
Well, and I don't think it's just us. We heard from some other nurses, and I've heard from a couple other people that really lit a fire under them, and that's awesome.
Yeah.
We forget on a day-to-day basis when you're slogging through the trenches sometimes, what it is we do and how proud of being nurses we should be.
Yeah.
And one of the things we talked about, Sean, is what do we do next? How do we take that to the next level? Mm-hmm. And you and I have decided that we wanted to take that momentum and use it in really pushing some different topics, categories, issues that are out there right now, and trying to figure out the best way for us to do something better.
Yeah.
A couple of those we talked about. You're very, very passionate about educating nurses and new nurses and student nurses as well. With me, it's suicide prevention. We've talked about vaccines with Dr. Mike Sevilla quite a few times already. And a couple of those on that list are ones that you're very passionate about, and I'll let you finish off the list.
Well, I think educating nurses kind of goes, I think it ties in lovely with your passion, which is, suicide prevention or let's talk about, bullying and lateral violence. New nurses, seasoned nurses, for some reason, have a hard time getting along sometimes. And we love to talk about how nurses eat their young. So one of my great passions is to try and squash that little urban legend of new nurses being eaten alive by the seasoned nurses. We've decided that The View gave us the gift, a gift of realizing how special and how amazing our profession really is. And it kind of gave us it pushed the reset button. It made us realize that, you know, what we do affects every living soul out there.
Oh my gosh. Just looking at the social media posts of, you know, there was a truck driver that put up a post about how much he loved nurses and how much nurses have meant to him in his profession, which was phenomenal. To me, that was something out of left field. I never would have expected that. But I think what it did is it also proved that nurses have a huge voice in this world. You know, that hashtag Nurses Unite, look at how far that went.
Yeah.
To the point where The View lost quite a few.
I do not know how accurate
where rubber meets the road.
I don't know how accurate that list is, but the last I checked, there's somewhere between 9 to 12 different companies that have decided not to advertise on The View anymore. And I know for sure there's at least 4, but anything beyond that could be hearsay. But the bottom line is that we influence change even at a minute level. You know, that these companies were taken aback by how we felt about The View.
Correct.
And it had nothing to do with The View themselves. It's how we reacted.
Well, and what a great, you know, proof is in the pudding. Mm-hmm. Look at that. We now realize and we have seen what our voices can do. So now the next step is to take it through all of those things that we've talked about and try to push, not to use the word agenda, but I'm going to use the word agenda, in doing greater good for the larger population. Yeah. So one of the things that I've been very excited about is the fact that you are utilizing, and you started utilizing, the hashtag Ask the NP.
Yeah. So it went in reverse. I realized there was a need out there for a little bit less screaming and a little bit more quality information out there. This kind of throws it's kind of a branch off of FOAMed, about open access medical education, and phoned with an N, open access nursing education, utilizing social media to educate our brothers and sisters in some way, shape, or form. Something from common practice all the way to evidence-based medicine, a way of elevating each other and elevating our profession. And it isn't just nursing, even though that's where I'm choosing to utilize my education and my training and to pass on my knowledge is in nursing. Here at the Change of Shift, I've coined the phrase shared suffering. And what I mean by that is that every single nurse in some way, shape, or form at some point in their career is going to experience the same thing. We're going to experience it to some degree. Something as simple as the first day of nursing school, or graduating from nursing school, or the very first Foley you inserted. The list is endless. All I know is that we all have shared in the suffering. So I wanted to figure out a way for me not only to share my suffering and share my education, but I wanted a way to bring attention to it. And you and I are the old heads of Twitter, because way back in the 05, 06, 07, I think it was 06 or 07 when the first hashtag was created, or I don't know if it was created or it was used. One of the first times hashtags was used was to track something. It was to monitor or track a thought or an idea. And the one that comes to mind that I always remember way back when Twitter was young was the Follow Friday. The Follow Friday hashtag. I forgot about that. The Follow Friday hashtag was huge back then, because back then you wanted to follow as many people as you knew, and the Twitter search engine hadn't really been created yet. You couldn't search people through Google. You couldn't search for Twitter users on Google very effectively. So it was who you knew someone else, knew someone else, knew someone else. And it was kind of the 6 degrees of separation. That's how you got to meet people. Well, somebody created the Follow Friday, and it was just hashtag, hashtag, It was just hashtag FF. And all that meant was follow Friday. And you threw out a tweet with people that you thought were worth following. And that hashtag became a huge movement. And I still think they use it to this day, but I think they've kind of use it for other things now. But that's where my hashtag Ask the NP came about, is that I wanted to use a hashtag that was my, I don't want to say call sign, but it identified me. First of all, I'm an NP, so that was an easy one. And I didn't want to use just hashtag NP. And I honestly wish I knew why that I created Ask the NP, but I wanted a hashtag that was identifiable, searchable, and something short, because you don't want to take up all 140 characters with a hashtag.
Well, and I think your subconscious must have been brewing somewhere, because it fit so well into, it's like the pieces all fell into place for what we're doing now.
Yeah. So my wife and I live by the adage that everything happens for a reason, whether you have an explanation for it or not. Yeah. Everything happens for a reason. And I created that hashtag Ask the NP right around the time that my social media presence changed. And it has served me well, because there's a couple hashtags that have gotten a lot of attention, and not just on Twitter. Hashtags are not as well utilized on Facebook as they thought they would. And hashtags on Instagram and other social media avenues, they're utilized, but I wouldn't say that they're being utilized as a search engine. They're just being utilized as a way of communicating. And we, jokingly do the hashtag thing. But if anybody follows Jimmy Fallon out there with the Tonight Show, him and Justin Timberlake did a little skit where they hashtag everything. And we went from hashtagging something small and simple to basically you don't say any words, you just hashtag everything. So, we don't know how to be reserved. We have to overdo it every time. So my Ask the NP hashtag came about to educate nurses. And most of my hashtags right now have been about new nurses, because that's my passion. It's just a way of identifying with challenges that every new nurse is going to have. Every so often I'll throw in just generalized nursing suggestions or tips. So these Ask the NP hashtags turn out to be tips and or suggestions or tricks of navigating through your career at any point.
So if I were someone who is a nurse and I am on Twitter, how do I use that? What would you like to see me do?
I eventually would like nurses to utilize the hashtag to once again pull in resources, not just me, but anybody that's following the hashtag, to be able to help them with whatever it is they're having a challenge with. If it's something as simple as a study topic, or something as complex as I don't know what to do now that I'm a nurse, or I'm changing careers, or lateral violence, bullying, take your pick. Anything that troubles a nurse, you could utilize the Ask the NP hashtag to reach out to other nurses out there, to reach out to other NPs out there, to figure out how to solve your problem.
So I know you've had a couple of examples and you've started using this. What are a couple of your favorites that you've used so far?
Favorites, we'll just list some of the more popular ones at this point. I'm going to put it in the Twitter feed right now. This one, I have to bashfully say that this came from a personal experience, but one of my hashtag Ask the NP was titled New Nurses, don't ever fake it. If you don't know something, tell someone, it's okay. And it was multifaceted. It had different angles. First of all, nobody should ever fake anything that they're doing. And it was and I remember specifically as a new nurse, the first time that I didn't hear a heart sound, and I panicked thinking I was doing something wrong. So I faked it when I was in school, because it was an obese human being. It was someone that had cardiac history, and it was difficult to actually auscultate their heart sounds. The only way that you could auscultate them correctly is that you had to turn them on their side so that their heart would rub a little bit closer to their chest wall so that you could actually listen to them. I didn't know that, later down the line that not hearing heart sounds actually can be an indicator for a very serious problem going on. And I thought it was just, lack of skill for me. So instead of me saying, I don't hear anything, I faked it. So that was from a personal experience, as well as seeing other nurses who are afraid to speak up. When they don't know something, they're afraid to speak up. They feel like they're going to get yelled at, made fun of, or they're not going to be treated equally in some way, shape, or form. So I used it to address multiple things.
Well, and it starts a dialogue, and that's what I think is so important, because, without having one or two people stand up and say, no, this is really what I'm feeling. This is really what I see. This is really what I'm dealing with. You don't have that conversation. And all of a sudden you get 2, 3, 4 people together and you're like, oh my gosh, me too. And then you work through it. And the next time it isn't as difficult. In my role as a flight nurse, it's not uncommon for me to walk into a room, have no idea how to use a pump because it's some new equipment that I haven't seen before. And so I've flipped to the complete opposite side of that, where I probably ask, they probably look at me sometimes and think, what?
Yeah. But how long did it take you to do that?
It took me a couple of years.
Yeah. So.
And you figure out a way to ask things differently. And now time is of the essence with my life. So I just throw it out there. And it's nice to be in a position where I have that confidence, but I also see students all the time in the different hospitals I go to. And to be able to lead by example, I think, is one of the most important things of where I am in my career right now. So I know you've got one more, and we have a very interesting segment we're going to do tonight. So we're going to have to watch our time, but
yes.
let's go through this one more.
Yeah. So the other one then is actually a little bit more humorous. This one is for nursing students, any nursing student. And it was, nursing students, learn how to mouth breathe. Trust me on this one. You'll thank me later. Hashtag Ask the NP. I've actually done a couple blog posts about this, and I remember doing a video about it as well. For the non-nursing individuals in society, mouth breathing there's an art and a science to it, because there are a gazillion reasons you need to mouth breathe, but you need to know how to mouth breathe, or at least eventually in your career as a bedside nurse, and this is taking care of patients, period, pre-hospital, intra-hospital, doesn't matter. You end up mouth breathing without even knowing it, because you know it's coming.
Yeah.
Because there are very interesting smells that nurses have to deal with, and you either just suck it up and you deal with the smell, or you figure out a way to do your job without passing out from the smell. Do we really need to discuss C. diff, or what necrotizing fasciitis smells like, or what a GI bleed smells like, or what Pseudomonas tracheostomy smell like? All these things, to the new nurse, you may have read about them, but you will understand fully once you smell it once. So
I've had to try to teach my pilots how to mouth breathe. Yeah.
I don't even know. I don't know if anyone actually physically told me to do it. I think I did it by, reflex one day and realized, wow, that was so easy. I'm going to have to do that from now on. So,
well, and for those who are listening, who don't work in healthcare, we're making a little bit of light on something that's, maybe sound a little bit jaded, and we don't mean to, but there are really certain things you have to be able to do. And we should do an entire evening, Sean, about what you don't like, because every single nurse I think I've met has one thing that just grosses them out, whether it's sputum, sing bone. Yeah, it's really interesting. It's really interesting how different people have different things that they just don't like. And for us to be able to handle as much as we do handle and just have one thing, that's pretty impressive.
Yeah. What is your nursing vice?
Yeah. Mine is a bloody nose. I can handle anything but a bloody nose.
That's crazy.
All right. So before we go off on that left field tangent, you spoke earlier about how much education and educating new nurses is so important. And one of the things that I've done in my course of being a blogger is talk to quite a few students who are either nursing students or, more importantly, or high school students and interested in becoming a nurse. And we have the opportunity tonight. A very good friend of mine, Amy, her daughter, Hannah, is a sophomore in high school in Florida, and she has an assignment. So we're going to take her assignment and step it up a notch. So hi, Hannah. Sorry you couldn't be with us tonight.
Hello, Hannah.
But one of the things that she needed to do for her assignment was she needed someone in healthcare, I believe, or in a profession she was interested in, answer questions related to their profession. So Hannah, you get us both on this one. So hopefully I have a list of questions.
Stay on track.
Yeah, stay on track and get through all the questions. So, and I think we'll both be able to pipe up. So I feel like we should have a minute button.
Yeah.
Or a buzzer where like,
timer.
Ding, you're done.
I could
ding,
get my phone out and
smack it on the table. All right. So questions from Hannah, high school sophomore in Florida. This fits great under the hashtag Ask the NP.
Yes.
All right. So Sean, I'm going to let you tackle this first question. We're going to talk about nursing in general. All right. So what skills are required in your position on a day-to-day basis?
Communication skills. You have to have effective communication skills. For my job specifically, I'm sorry, let's just say nursing in general, you have to have at least a keen sense of anticipation, and you should have a base skill level in critical thinking. The rest you can figure out after that. Those are my top three. I'll stick to three.
Those are good three. Those are really good three. So I think asking questions and knowing your limitations, that's definitely a skill you have to have. And being able to, you said critically thinking, but be able to think on your feet. I think those are all very, very important to nursing. All right. You want to tackle the next question as well? That was
only two. What's your third one? Come on.
Oh, what's my third one?
Tick, tock, tick, tock, tick,
tock. God, there are so many. Where do you start?
Tick, tock, tick, tock. You're failing miserably at this.
Yeah, Hannah, I am. I'm failing.
You're failing.
Sean got the good ones. He got the good answers.
Can't even get a third one. That's horrible.
Show up on time.
Fail. Anyway, moving on to question 2. All right. So, what parts of your job do you find the most challenging?
A couple of things. Nursing changes so quickly. So being able to keep up with the latest, the latest medications, the latest techniques, the latest, whatever your specialty is in nursing, that can be a challenge. The other thing that I find really challenging is to continue to show up every day with a smile on my face, even when things are either rough at home, or when I have a patient that really, or family and both, that really affect me emotionally. So it's trying to be professional, but be emotionally tiptoeing down a certain road.
You like my emotional bank?
Yeah.
Like that, huh? For me, I'm just going to say, because it's a passion of mine, it would be finding a healthy work-life balance.
which we know that nurses generally don't
horribly
have.
fail horribly at. So,
all right, question number 3. How many hours do you work in a typical week?
I, in my job, don't have a typical week. In a 7-day period, I can work 70 plus hours, or in a 7-day period, I could work 0. So I believe Emily and I can both agree on this. Shift work is hard to predict. So if you do it, so I can't say a week. I don't have a typical week. Typical pay period, I'm required to work a total of 80 hours, but anywhere from 80 to 120 can happen.
So, and just to clarify this for Hannah as well, nurses usually work 12-hour shifts in the hospital. If you work in a doctor's office or you're a school nurse, your hours are going to vary. But as an in-hospital nurse, you'll work a 12-hour shift in general. You usually work three a week. If they're trying to keep the budget down and not having overtime, but we all know that there's a huge nursing shortage. So overtime is very plentiful. So, and you don't always get out on time. That's the other thing that people need to realize.
No.
You're prepared for a 12-hour work day. You get there 15 or 20 minutes early, and you may be there for 13 and a half hours charting.
The human body doesn't have a time clock.
Correct.
You take care of humans. So what are we at? 3, 4?
We're at 4.
All right. So Hannah's 4th question. Are there any negatives to your job?
Difficulty in work-life balance. Long hours. But those, I think you can trade those off because what we do is you're so impassioned at being a nurse.
I would go with the emotional seesaw.
Yeah. Oh gosh, absolutely.
Emotional seesaw. So we've talked about it a couple times that like a nurse on a singular shift in a singular hour can stretch the range of emotions from completely happy and elated to wiping the tears from your face because of either heartbreak or exhaustion. So having emotional stability is very, very difficult. That's negative. And of course, negative, and once again, a passion of mine would be the lateral violence, the bullying. So it still exists. And it's not just between nurses, it's between nurses and other professions.
Yeah. And Hannah, what we're talking about with lateral violence, we're talking about bullying between professionals. So I know bullying is very common amongst high school students. I've dealt with it, Sean. I'm sure you dealt with it as well. But it also still happens in the professional field. So as much as I'm embarrassed to say that it exists in the hospital, it exists in the medical field in general. So on those really negative notes, Sean, what do you find the most enjoyable? Question number 5.
The most enjoyable is watching a human being go from the brink of death to walking out of there on their own 2 feet, and to be able to spend another day with their families. That is probably the most rewarding for me, is to see someone as sick as a human body can get and be able to see them later after they've recovered. On a handful of occasions, I've had patients come back into the hospital and thank me. And that's when I become a just river of tears, because that's the reason why I do what I do.
I think another thing that I find very enjoyable as well, I work with quite a few newer flight nurses. They're seasoned nurses from a critical and emergency nursing standpoint, but they're new flight nurses. And I love we do debriefings between each other. They're very informal, but because of HIPAA, you can't go home and talk about what you did at work. So we tend to share those things between coworkers, because number one, we understand HIPAA, and number two, a lot of times you can't go home and say, "Oh, this happened," and have your non-healthcare spouse or family member understand it. So one of the things I find most enjoyable is when I see the aha moment on the newer nurses' faces. I had a colleague of mine that God, respect her, beyond respect her, and am so grateful that she's a flight nurse, had a patient who she flew and did just this miraculous turnaround. And we talked about how much that meant to her to walk into a room and expect one thing and to see something very, very different, and understand that what she did was directly related to that patient going home. So that as a more seasoned nurse, seeing those feelings on my colleagues' faces is just amazing.
Oh, yeah. All right. Number 6. Are too many or too few people entering this profession? We kind of already touched on that one. Too few are entering and too many are leaving. So we have a nursing shortage that has been going on for, I'd say, close to a decade now. In one way, shape, or form, the shortage has either gotten better or worse, but it's never gone away. So we still have a nursing shortage. We have the current seasoned nurses who are on the verge of retirement. That number outweighs or is larger than the current number of nurses who are just starting or entering the profession.
Yeah, and that's just a very easy question to answer. I mean, statistically speaking, the numbers are all out there of how few nurses or how many more nurses we need. And the beauty is people are always going to need a nurse.
Yeah.
You know, when I have people who are considering nursing as a profession, that's what I try to tell them. Like, you can get in your car and drive anywhere, land in a spot, and for the most part, get a job. You still have to be good at what you do, but you know, this is not a profession that's going to go away, especially with the baby boomer generation getting, aging. All right. So Sean, I'm going to let you tackle this one. Why? It's number 7. Why do people leave this field or company?
I hate to say it, and it's, I'll just say it. Money. Absolutely money. I don't, in my heart of hearts, I don't think people leave their job or leave their company or leave this field because they were unhappy with their choice of profession. Most people, and I say that gently, most people enter this profession and have a good idea by the time they get out of nursing school what they're in for. Maybe there's a couple things you're going to learn once you get out there in the working force, but you kind of get a good idea in nursing school what nurses are about and what we can do and the day-to-day out there in the job. So it has to do, I think people leave the job, company, or the profession because of the same reasons that everybody else leaves other professions, is that, job stressors, unhappy work environment, not being treated with respect, being asked to do too much, not being paid enough, working overtime without any compensation. So I don't think it's exclusive to nursing. I don't think there's anything in nursing that is exclusive to why we leave the profession.
Well, and I think too that if you have a very healthy environment that you're working in where you feel supported, pay is not the be all end all in nursing. I think there are quite a few nurses who would tell you that they would be happy to stay in a position with a little bit less pay if the environment is healthy, if they have supportive management, supportive leadership. We don't need pats on the head all the time, but we need to be recognized in some way, shape, or form. And simply being told thank you by leadership. And I think we're going to find, and this is my humble opinion, but I think we're going to find over time that the lack of leadership that we see in nursing, because nurses are caregivers, we're taught to be nurses, but we're not taught to be leaders. And I think that is going to be, I think a lot of chickens are going to come home to roost over time. as we realize that leadership is so lacking. So that's a pretty complex answer to that seemingly simple question.
How about saying long-winded?
Hey, pot calling the kettle black.
All right.
Are you the pot or are you the kettle?
I don't know. Switch roles. I don't want to hear that one. All right. So next question, moving right along. How did you get your job?
I begged. It's as simple as that. For my position that I'm in right now, flight nurses, a lot of people want the positions. Very few will have the timing or the credentials or so yeah. I was kind of a pest and I really stayed at it because that's what I wanted to fly as a nurse. But in general, it's, luck favors a prepared mind. So having your credentials, having your resume looking good, being proactive at continuing to be a professional over time, that's very important, especially if you decide to move positions or move from one nursing job to the other. And your first job as a nurse, I was following quite a lot of stuff on Reddit over the last year about nurses who are working in new graduates who are working in certain areas and couldn't find jobs. And, I think one of the pieces of advice everyone kept giving was that you need to find externships. You need to find volunteer, something to pad your resume as well. Long-winded again.
Yep. Didn't say anything. I found my job was easy. My first job was working in the same hospital that I did my clinicals. It was the same hospital. I was already employed as a transporter. And I had a previous position as an athletic trainer in that hospital system when I was in nursing school. So it was a no-brain transition that I went from nursing school and I actually got an ICU job right out of school. So I guess that was just right place, right time kind of thing for me. I didn't have to work really hard for it. So that was easy for me. See how short that was? See how easy that was? All right, number 9. If you could start all over again, would you change your career path in any way and why?
No, absolutely not.
No.
And I kind of came to the nursing profession in a roundabout way. I didn't get in the first time I applied. So, you said it earlier that you believe in fate, and that was really fate for me. Had I gotten in, I never would have joined the Army. I never would have gotten my experience in pre-hospital. I never would have flown. I never would have worked in Los Angeles as an EMT. And I never, ever would have ended up in grad school at the University of Pennsylvania. And those pieces and parts along that path really, really influenced who I am today. And, I've talked about the interviews I've been through for a nurse practitioner position over the last month. And there's no way I would have been able to go into those with a resume that looks like it does now.
Yeah.
And it's
go ahead.
No, go. Nope. I'm done. I'm done.
I would have loved to have started earlier if I had to do it all over again. But then I would not be where I'm at. I would not be married to the woman I'm married to because I met my wife in nursing school. Got married late in life. Nursing was technically a third career for me. So would I change my path? No, but I would have loved to have started a little bit earlier because I made a couple mistakes along the way. But kind of along the same line as Emily, I found nursing almost by accident or by fate because I got admitted to the hospital for an injury. And that's when I met my very first male nurse. I thought nurses were all women and that they all passed pills and cleaned up poop. And I was severely wrong. So thankfully I got hurt and it wasn't a devastating career-ending thing, and I met a male nurse. So would never want to. I would never want to be doing anything else at this point in my life.
Amen.
So
I completely agree with you.
Next question.
All right, number 10, and we're doing pretty well. We need to speed it up a little. All right. Ding, ding. What educational preparation would you recommend for someone who wants to advance in this field?
Never stop learning, period. End of story. However that happens, whether it's going back to school for collegial experience, certifications, CEUs, seminars, online, I don't care. Just be a sponge.
Yep. And with that, you can get your RN as an associate's degree, as a bachelor's degree. So I think I wouldn't necessarily recommend one path or another. However, I would recommend doing as much research to find the path that's right for you as an individual.
Yeah.
All right. Question 11. What qualifications do you seek in a new hire?
So if I'm hiring someone, I want someone who has good time management skills. I want someone who has an emotional bank, meaning that they have experienced something tough in their lives, something that was challenging in their lives. I don't want someone who's had it on easy street their whole life. You know, I want someone who has maybe failed a couple times, because those are the people that know how to succeed. And you got to be personable. If I don't like you, I'm not going to work with you. I don't want you to work with me. I got to like you in some way, shape, or form. We have to have a good dialogue and a good relationship. And I hate to say that, but that's the truth. If you're an asshole, why am I going to hire you?
Yep. I'm not even going to add anything to that. That was, if you can't be a teammate with someone, you shouldn't be there.
Yeah. Nursing is not a singular person job. You have to work as a team. Moving on.
All right, number 12.
How do most people enter this profession? Ooh, that's a tough one.
Ooh. Yeah, that really is. That goes back to educational preparation, I think. You can't become an RN without having a degree of some sort. So it's either an associate's degree or a bachelor's degree. And then the next step after that is taking a test, which is the NCLEX, NCLEX for Hannah. And that is your pathway into nursing. You can't do anything without passing that exam and getting that degree.
That's a question that would take a lot of thought and a lot of verbiage. There is no typical way people enter this profession. Everybody seems to have their own path. A lot of people enter this profession because of somebody else they knew, or a nurse that inspired them, affected them in some way, or nurse in the family, nurse friend, something like that. At least that seems to be a common theme, but it definitely doesn't exclude others. So,
yeah.
Next question, number 13. What do you do if you can't solve a problem on your own? I'm going to jump on this one. We covered
that earlier.
Yeah, we did. Utilize your resources. You have to utilize your resources. If you don't know the answer, you better be able to find someone who can get you the answer, or you find the answer yourself. One of the biggest things that we as nurses learn from day one is you will not know everything. You can't. It's impossible. No. So you have to know how to find it. Good.
Simple as that.
Yeah.
Simple as that.
This next question is very vague.
Oh my gosh.
So Hannah is asking us, what kinds of decisions do you make? And the best thing I can say is we make decisions that affect lives. Meaning, a decision that I make can either save a life or eliminate one. So it's that grave of the decisions we make as nurses, because when we make a mistake, human beings have bad days, and it's just that simple.
Well, and we make very small decisions, very big decisions, everything from how you prioritize your time, how you decide that you're going to approach someone in conversation. And like Sean said, I don't think the general public understands how many of those decisions can be life-changing, can be life-saving.
And they're split second.
Yes, many times. So that's why critical thinking skills are so important. Yeah. But, other days, the biggest decision I make is where I'm ordering takeout from. That's usually where we start our question in the morning with our briefing is, okay, who brought lunch and where are we ordering from?
I know, who's got the coffee?
Yeah, well, and who made
it or who brought it? Yeah.
How old is the coffee?
This is true. Well, it's a whole other conversation. Moving on.
Yeah.
Moving on. Next question.
All right.
How has your job affected your lifestyle?
Wow, that's a good question.
Just going to answer it this way. How has my job not affected my lifestyle? Everything about my job affects my lifestyle. It's really just too detailed of an answer that we are never not a nurse. It's just that simple.
Yes. You 24/7, you're a nurse. Questions from family members, being in, my friends laugh at me. I was at an event the other day and this gentleman walked by, and in my head and under my breath, I'm diagnosing things. Mm-hmm. Or how many times have you walked through and been like, ooh, hey, love to shove an IV in that.
Or someone coughing and wheezing and you're avoiding them because
yep, you're like,
I'm on here. I'm sorry. you hurry up. You hurry up and go.
Yep. Or somebody, God forbid, who walks out of a bathroom without washing their hands.
Oh, don't get me started on that. Don't get me started on that. I will try and remember. I'm going to write it down right now. You and I, you were still on hiatus. There's a picture.
Oh, no.
There's a picture that I posted. Let me write this down. Hold on.
Okay.
I have to write this down before I forget.
All right. So while you're writing that down, Hannah, these questions, and for those of you who are just logging in, thank you. Sean uses a hashtag called Ask the MP. And along with that, we decided tonight we were actually asked some questions by a high school sophomore about being nurses. So what we're doing is we're kind of stepping up that assignment for her a notch, and we're doing our whole a good portion of the podcast going through and answering those questions for her. So, Hannah, we're so glad you asked us these.
We'll talk about it in the post show. That's what we'll do. I'll talk about it.
Okay, your picture.
Yeah. All right.
You just couldn't leave it.
Moving on.
All right. Number 16, and we're still doing pretty well for time. What kinds of things did you do before you entered this occupation?
My very first job, I was a manager for a very popular retail company for many years. Not going to say which one. And while I was doing that, I went to college and graduated and became a certified athletic trainer. Was that for about 10 to 15 years, and went back to school and became a nurse, and was that for a number of years before I became a nurse practitioner. I guess you could, lump nurse and nurse practitioner together. It's kind of the same profession. So,
yeah. So, and I'll answer this quick. I think I answered it pretty well before. I tried to get into nursing school, did not get accepted, joined the Army, became a medic in the Army, and was told after I left the Army, was an EMT basic in Los Angeles and Orange counties. I had nursing school applications in one pile, medical school applications in another. A nurse mentor of mine said, you need to go to nursing school. And so I continued to push through until I finished nursing school. In that process, though, one of the best jobs I ever had was delivering pizzas in Kentucky while I was in nursing school. So you do what you've got to do to make it through.
Well, if we're going to talk about greatest jobs, one of the greatest jobs I ever had was being a bartender. So
we're going to walk away from that one. All right. What is the job above your job?
My supervisor, or the title is actually called you know, where I work, they're called advanced practice providers. So there's an advanced practice provider supervisor who is basically the boss of us. If you really want to go up, what's the job above mine would be my physician colleagues. So.
Perfect answer. All right. Sean, where do you see yourself in 5 years?
Pushing away the fans from this podcast after we've made it to Hollywood and we're employing a handful of people to run everything. Oh, I'm sorry. Wait, getting off. I foresee myself doing exactly what I'm doing. Maybe I'll be that supervisor that I was just speaking of, but I will never leave the bedside. I love it too much.
Yeah, I agree. I have a couple other passions that are that go along with nursing. One of them is process improvement, which hospitals utilize all the time. I use it constantly in my life, and have integrated that into my position as a flight nurse. I also would really like to get more into doing nursing research and publishing. I think it's such a huge field, and so many people have that exact reaction. They hate it.
No,
and they're scared of it.
I'm bad at it. That's the problem. It's not that because I know how important it is, and I love the knowledge that I gain from it. It's very hard for me.
Oh, yeah. See, and me on the other hand, I'm
well, if it makes me feel any better, I am part of a research study that's getting ready to start where I work. Okay, so
Bravo.
I'm working on it.
So just because we're in nursing doesn't mean that all we do is stand at the bedside. There are multiple facets of our job, and there are many other paths that you can take beyond.
So what I tell every single person out there is why our profession is the greatest is that you can work everywhere and do everything as a nurse and never go back to school. Because you could work in 6 different departments and work in 6 different facilities in 6 different states doing the same job and never have to go back to school. Once you get your RN, not saying that you should settle for just your RN, because we both believe in advancing your education, but you seriously can, other than on-the-job training, you can go anywhere. It's amazing what you can do with just being an RN. And I don't want to say just, but
better not say just.
ducking swings there.
Yeah.
All right, moving on. We're
And we've got a couple really intense questions.
How is the economy affecting this industry? I'm trying to make these answers short. How is the economy affecting it? It's shortchanging us in places that it should not. If we're not being paid the money that we should be being paid, then we're getting curtailed and we're getting shortchanged on benefits in some way, shape, or form. Don't even let me start on, your investments and your 401ks and things like that. So the economy is definitely taking a bite out of that.
Well, and I think the cost of healthcare is taking a bite out of it as well. And I'm going to do this very quickly. 2 different ways. The first way is how much we pay for our health insurance. That equates almost a pay cut every year because we have to contribute more to how much we pay for our health insurance. But thank goodness we all have it available. The other thing that it does is as the Affordable Health Care Act, health insurance and reimbursements go down, it decreases the number of resources that we have to be able to do our jobs. So we have to become more lean in what we do. All right. So number 20, we are almost there, Hannah.
And they get even more difficult.
Yeah, these questions.
In what ways is your occupation changing? It's getting better because we are acquiring more education, more training, and the healthcare system as a whole is starting to recognize that the care a patient receives is completely determined by the nurse caring for them in almost every aspect. So you need to invest the time to train them and educate your nurses appropriately, because patient outcomes improve when nurses are as educated and trained as much as possible. The higher the education, the higher the training, the better the patient outcome. An outcome could be anything, something as simple as not falling all the way to recovering from a devastating injury. So outcomes is a broad term.
All right. So the short answer, Hannah, is that we are being expected to do more with less. People are paying attention to what the outcomes are of what we do. So that's probably the more succinct way of putting it, because that is a 3-hour conversation. Difficult one to answer. All right. Couple more. Mm-hmm. Do you ever take your work home with you?
I do not. I have a gift for that. I never bring it home. And if I do, it shows up for 5 minutes and that's it. And that's my rule. That was my rule since the start.
I do take mine home with me, unfortunately. And I'm still trying to figure out a way to deal with it. I think the level of tragedy that I can and sometimes do deal with. But I also am able to shut it off after a while as well. So I carry it, but I don't carry it. We're all going to have those times where, because what we do is can be so difficult. But
our job and our career is not in a vacuum, and that's
correct.
It's not in a cubicle. That's a better term. It's not in a cubicle.
Correct.
So,
all right, typical day. Let's talk about the typical day of a nurse. This is another really long.
This is going to be shotgun. Here's the shotgun version. You get ready for work. You go to work. You either arrive in work clothing, change into your work clothing. You prepare for sign outs from wherever you're going from the shift that is ending. You're starting your shift. The ending shift is going to provide you with a report of what happened before you showed up. That report is finished. You work your shift. You may schedule 8, but you might be there 10 or more, depending on the acuity level of the patient load and the revolving door of the unit you work on. Revolving door meaning how many patients get admitted, how many patients get discharged, how many patients unfortunately will pass. The list goes on. When you are done with your shift, you're going to have to do the exact same thing that you did at the beginning of your shift, which is do another sign out. You will sign out however long that takes, and then you will either change out of your clothes and go home, or you will already be in your clothes and you will go home. That is the shotgun version of a bedside nurse.
And then in the middle of all of that, you have to assess your patients. You have to plan your day for where those patients have to go. Are they going to CAT scan? Are they going to MRI? Do they have physical therapy? What about meals? When are their medications again? So you have to take all of that information and plan out your entire day and get your charting done somewhere in the middle of all of that as well. That is the day of a nurse in a nutshell.
Moving on.
All right. How much is your yearly salary? I actually looked up the average pay for an RN in 2013. It was right around $67,000 a year.
Wow. It's definitely increased since when I started as a bedside RN.
Yeah.
So bedside RN, and then the median salary for an NP in my area of the world is somewhere between 80 to 100, depending on where you go, who you work for, that kind of thing. 80 to 100,000 a year. So,
and that really will change by region, by shift, by your benefits. Correct. So
another difficult question there, Hannah.
Yeah.
Next one. What are some common career paths in this field? Common?
If you can figure out anything you want to do in nursing, you can either go work with babies, you can be in the NICU where the babies are this big, you can work in geriatrics, which is people who are on the back end of their lifespan. You can do orthopedics, you can do ER nursing, you can do flight nursing, you can do school nursing, you can become a midwife and deliver babies. It is so wide open. That's why our job is so awesome. You can be an educator, you can do research, you can be a professor.
You can work in law. You can
work in law.
Yeah.
If you have a pulse and are willing to go to school, you can find a niche in nursing that will fit you and your personality and your just.
Do you like to travel? Because you could travel around the world.
Oh, you can go into, oh my gosh, my friend, he doesn't know this, but I call him Ebola Sean because I know so many Seans. And he went and volunteered and went to Liberia and worked with Ebola patients. I mean, if you can think of it, they need a nurse there.
They do.
I love this profession. That's awesome.
Ditto. Moving on. Last question number 25. Is there a salary ceiling? Unfortunately, there is, but it all depends on where you work. So,
okay, I'll agree with that. I was going to say no. Well, you're not going to make millions as a nurse.
No. So you have to think in terms of the facility you work for. The facility will cap your salary at some point, but it will take decades for that to happen. So that kind of ties into the economy problem. Because when I first started nursing, salary increases on your yearly evaluation were very generous, or at least were reputable. Now it's like a 1% to 2%. You might get lucky if you get 3%. So 3% of your salary isn't a lot, but it becomes a lot the longer you're in the profession, because then you make more money. So 3% of $30 is only $3 or $1, sorry. But 3% of $300 or $300,000, that becomes a lot of money. So that's a very long-winded answer. My turn.
Well, and I think it depends on how hard you want to work too.
Yeah.
A lot of nurses work multiple jobs, and they also will, find ways of fitting in elsewhere where they are going to make more money over time after they've not worked. So for those of you who are just logging in, thank you. We were answering questions for Hannah, who is a sophomore in high school in Florida. She had an assignment to ask someone about their profession, and she chose nursing. And this fits into our utilization of the hashtag #AskTheNP, as in nurse practitioner. And that hashtag is for nurses, patients, anyone who have questions about being a nurse. So, whew, that was a lot.
That was a lot. It was a lot. Yeah, that was.
Hannah, thank you. Yes. Thank you. That was awesome.
Hannah, you know what? You just gave us 25 things that we can dedicate, and we could have 25 separate podcasts.
We could.
Concerning all of your questions there. So we're going to be saving those. So thank you. That concludes probably the meat and potatoes of this particular episode. It was really about establishing, the advice, what we're going to call the advice column, or the advice hashtag #AskTheNP. I'm hoping this will evolve. I think it'll be slow to start, but I think it has great potential. As of now, our podcast does not have a very set schedule. It is very random and can be spontaneous at times. Emily and I have had many discussions over trying to make it somewhat more predictable, but I think for at least in the short term, we're going to go with whatever is available right now, because we both work shifts. We both work odd days. So we're going to just go with the flow right now. The great thing is that we are on episode 5 or 6. We're on 5. We already have 3 more that are booked as of now. And all 3 of those are interviews.
I'm so excited. Well, and one of the things that I'm realizing is that all of these, like even the questions that Hannah asked us, we're finding people who are experts in these fields. So they're experts in a niche of nursing, which brings so much to the table. So I'm super excited because I am learning a lot as we do these.
So episode 6 is going to be on Monday, September 28th, same time, same channel, here on Blab. It'll be at 9 o'clock Eastern Standard Time.
28th or 29th?
28th.
Ooh, I put that down wrong.
Yeah, 28th, Monday.
Okay.
So Now you're going to make me double check. We're going to have to
Yeah,
double
I'm pulling
check.
up my calendar now too because I put the
So
29th over there.
should be the 29th, or Jesus, 28th. So you got me saying it now. So 28th.
28. Okay.
September 28th, we are going to be interviewing a fellow seasoned nurse. Name is Lisa Ford. Lisa is a postpartum RN, and she is a newly minted return to school master's student.
Woo.
She is currently attending, I think, Acapella University online to attain her master's in nursing. If I'm not mistaken, without actually checking my work, I'm pretty sure she's going into education in some way, shape, or form.
Nice.
The great thing about this interview, and this is someone I've known for a number of years on Twitter. The great thing that I'm excited about is that her view on education has changed. She was a diploma nurse like me.
Oh, nice.
So in the early years of Twitter, fun fact for you, you know that she has had 118,000 updates on her Twitter.
Are you serious?
118K.
Wow.
118K. There is 118,000 Twitter updates. She is a Twitter, I don't know what
Master.
the term to use. Master, okay. So in the early years, she was completely against nurses going back and getting their bachelors, just their bachelors. She felt that diploma nurses were adequately trained, in fact, were better trained than the bachelor's prepared were. And I am absolutely excited to hear her side of the story now that she has enrolled in a master's program.
Yeah.
So she walks the same path we do. She's a little she walks a little left of center. She says what's on her mind. She doesn't have much of a filter. So I'm excited and a little nervous on how this particular interview is going to go, but she's a wonderful person. She's a mother of two. She has a 19-month-old at home right now. So
and is in school. Wow.
Yes. Yeah. So it'll be wonderful to get her insight on how to manage all that.
So now that we have the date scheduled, we have the correct date on there now.
Yes.
And just thank you to Hannah for her questions. Don't forget to use the hashtag Ask the NP Nurse Practitioner. Our Twitter handle is Ask the COS, as in change of shift. And we also have a Facebook page, and our blog is thechangeofshift.com. So,
yes.
Sean, any last words?
As always, check your own pulse first.
Awesome.
Thanks everyone.
Have a good night.
Thanks for listening.